Welcome to the PI show. My name's Harry Nowicki and I'm here with some colleagues, Tony Carbone and a new member of the panel, Jennifer Cron.
Evening.
And tonight we're talking about medical negligence, and one of the reasons why Jennifer Cron's here is because she spent many years as a nurse.
Correct.
And you worked at the Alfred Hospital, the Monash Medical Centre, a number of private hospitals, and then decided in some weird way to change careers.
That's right, Harry.
And what happened?
Well, I thought I'd love to marry up the law and the medicine, and my desire to study law overtook practicing nursing, continuing to practice nursing. So I went to university, obtained my law degree, and obtained articles.
And the rest is history.
And the rest is history. And here I am at Nowicki Carbone.
No, that's great. And I think medical negligence is a very big field. I mean, you've been in hospitals and seen a lot over many years. And yeah, there's different cases, and the general theme is things do go wrong with people and attending doctors, attending hospitals. There can be some tragic results, but it's not always negligent.
No, that's right. Just because something has gone wrong doesn't necessarily mean that that person has acted in a negligent manner.
So, these cases, you've got to, carefully consider all the information, and I think we should just go to some of the cases where people have succeeded in court. One theme in a lot of the cases is a failure by doctors to diagnose a medical condition and give appropriate treatment early on. I think there's one case where there was a 40-year-old woman went to a GP, complained about headaches and a lot of pain in the body.
And importantly, they were some of those symptoms were meningeal symptoms such as photophobia, phonophobia, which is difficulty in hearing, stars before her eyes, and those sort of symptoms were terribly important for the GP to have picked up.
What did the GP do in this case?
Well, in this case, the
GP
did not order a CT scan of her brain.
So you're saying if there's enough symptoms surrounding the face, their head, ears, things like that?
Well, particularly symptoms that might... There's a warning that there could be something going on in this lady's brain, particularly that visually, auditory, headaches,
in the early
as I said, pain.
And I mean, I think in this case what happened was, I think 3 weeks later she had what's called a brain aneurysm.
She had a cerebral aneurysm that burst suddenly.
Which is a burst blood vessel in the brain.
That's right, the weakened walls of the artery.
And then she died.
Correct.
Who can claim?
Well,
what happens? The family sees a lawyer. What happens?
Well, this lady had a husband and 3 young children. They are all dependents. They can obviously claim. There's loss of services of her as a mother. She was going to return to the workforce because her husband wasn't able to work anymore over the next few years. So she was. There's loss of her income.
But there's also nervous shock. You can sue for nervous shock in these cases, can't you, Harry?
Sometimes nervous shock has got to be more than grief. I mean, the natural human reaction is for grief and for mourning. Someone's died, part of the family. But you've got to have for nervous shock something more.
Or a properly diagnosed psychological condition. Could be a post-traumatic stress, which is what you generally get in most of these cases.
Correct.
So in this case, the husband and the children can possibly sue the doctor.
The doctor.
And what do they have to establish?
Well, I'd have to establish that the doctor had breached his duty of care in referring the patient to have a cerebral angiogram.
So he should have ordered...
And CT scan.
He should have ordered a test. And
particular tests.
I think the interesting question is, would the test have made any difference?
Oh, isn't it of significance in this case that her headaches were over a 3-week period?
They were.
And how many times did she go and see the doctor?
3 times.
Oh, she'd been 3 times?
3 times
So
in
it's
a very
reasonably
close
significant
period of time, within the space of 2 weeks.
But Tony, again, the question is, well, you know, she might have had an angiogram, a CT scan of
and or both. They could have performed both tests.
But what difference would it have made? I mean, let's say she had it and nothing showed up. What difference would it have made?
Well, at least it would have eradicated the fact that she may or may not have had a
She could have had an emergency surgery.
Well, that's right. But they could have clipped that aneurysm, and she would have been
so
living today.
You say if they detected it early enough,
absolutely,
they could have given her emergency
intervened
surgical
and
intervention, done something about it, and all things being equal, she probably would have survived. People still die if they have.
Look, they can. That's a risk.
That's a risk.
Death.
Yeah.
With cerebral aneurysm that can just burst.
And they can burst suddenly and just die without any opportunity to go to hospital. Right. But also, if you have the operation, again, every operation has some risk.
There are risks with any operation. And the patients they should be told by their doctors what
but
sort of risks.
Isn't there a lot of cases, apart from failing to diagnose, there's a lot of misdiagnoses?
Misdiagnose, you fail to diagnose a proper condition.
Yeah.
So...
Or there could be a number of competing things going on.
But there's a case that went to court a few years ago where the doctor didn't diagnose cancer. And there's a big legal argument about what difference it would have made.
To the person's... living.
Yeah, I mean, what... You know,
but don't they say the earlier you get something, the better your prospects are, as a rule?
As a rule.
Yeah, I mean, that sort of stands to reason, doesn't it?
The earlier that you can diagnose and treat the patient as soon as possible, whether it be surgical
and
drug therapy.
And what effect would an early diagnosis have made? Because again, the woman, you know, has cancer. It spread, and I think she died within probably 12 months of diagnosis.
Well, they would
proper diagnosis.
Well, that's true. They'd have to look at the situation as to whether this lady had a form of cancer that was treatable
in some shape or form.
That's right, and whether it spread.
Yeah.
I think we've got to go to a break.
All right, well, that's all we've got time for. We're going to a sponsors break. We'll be back after the break.
There's nothing